Hi guys, welcome back to our channel. I'm Delia, founder and CEO of Musawo, an on-demand health and wellness app that provides Ugandans with access to quality healthcare information, services, and products. Joining me today is Dr. Mark Jjuuko. He's the former head of the COVID treatment unit and the current overall team advisor and trainer at Masaka Referral Hospital here in Uganda, as well as a resident orthopedic surgeon at Musawo National Referral Hospital. Now, I've known Dr. Jjuuko for more than a decade, right? Almost 13 years? We actually attended SOSH together. Shout out to Nabisunsa Namilyango class of 2008. So thanks for joining us, Dr. Mark. So tell us more about yourself, Dr. Jjuuko. Who is Dr. Mark Jjuuko and what do you stand for?
I am Dr. Mark Jjuuko. I am a resident orthopedic surgeon, former head of the COVID-19 treatment unit, Masaka Regional Referral Hospital. And currently I'm their overall team advisor and the lead trainer of the COVID-19 management teams. Dr. Jjuuko stands for holistic medicine, inclusive medicine, and medicine that caters for all categories of people.
Right. What inspired you, Dr. Mark, to build a career in medicine?
Building a career, I would say the start wasn't so clear-cut. But along the journey, you develop passion through the experiences you go through. They model you into what you would want to become. So the different passions, the different experiences I've gone through over the years, I've been in the field for over 8 years now. They've modeled me to what you see today. So what inspires me is the experiences that I've gone through. Some bad, some good, all that helps shape the person.
It's really interesting that you mentioned that the experiences one goes through really plays a huge role in who they end up being. Because if I recall, about 8 years ago, I was a student in training at Naguru Hospital. I think that's where we reunited for the first time, right?
Sure.
And you guys were really there for me and holding my hand in the hospital. But it's so crazy that at that time, when I was interacting with you guys, that is when the idea for my Musawo first came to me. It's actually you guys that inspired the idea in my mind. But at that time, I would have never thought that it would have all led up to here. So that was a very profound point that you made. Let's talk COVID. What is COVID-19? I mean, you would think that there's not a soul in the world right now that doesn't know the answer to that question. But yet there's still so many controversies and wrong information out there that most people don't really actually understand what it is. So what is COVID-19?
By and large, COVID-19 is a respiratory infection, primarily. There's a lot of misnomers in the community as regards COVID-19, and you find that different societies, different professionals have tried to define COVID-19. So I would say, one, we are trying to learn COVID-19. We're still in the learning environment as regards COVID-19. But to sum it up all, COVID-19 is a primary respiratory infection that has the capacity to shut down the respiratory system. But nonetheless, it affects various parts of the body. We've seen some cardiac manifestations of COVID-19. We've seen renal manifestations. We've seen neuro manifestations of COVID-19. So it's still a new disease. It's still a novel disease. We're learning, and hopefully sooner or later we shall know everything about COVID-19.
So it's not really just the senyigo mukambwe that most people think it is. It's not just a cold.
Yeah, it's not a cold. You know, these misnomers actually mislead the population.
Right.
And you find that everyone who gets to learn of the misnomer, like senyigo mukambwe, they're going to take it lightly.
Right.
But the reality is it's a serious respiratory infection that has the capability of halting your breath. So that is not Senyego Mugambe.
It's not something to be taken lightly at all.
It's not.
Prevention is better than cure. We hear this all the time. How do you think Uganda has managed prevention in the current pandemic? What are your thoughts on that?
Uganda, looking at our health system, I would say we've done quite a commendable job. Of course, with gaps here and there.
Yeah.
The start was really good, in my opinion.
Oh, yes.
We started off well. We were following up all the cases, doing the contact tracing very well. But we let our guns down, and currently, where we are now, it's a bit hard to get back to where we were initially. But I would say currently, not so good. However, there's still room for improvement.
Right.
But Uganda really had a good fight in the first months of the pandemic. And yeah, those days we held the infection to the fit population.
Man, I was so proud of us. I remember we shut down, I remember when the president first shut down schools, even before we got our first case. And so many countries were actually revering us for such a smooth and quick, serious response to it. But those days are over, are they?
I'll tell you one experience. I remember the first COVID-19 patient we managed in our unit.
Yeah.
I was on an ambulance, and we picked him from, he was a truck driver, we picked him from Chiyandongo. Chiyandongo to Masaka is over 400 kilometers. But we had to drive in the night. We got this guy at around 4 a.m.
Right.
Just because we didn't want him to spread the disease to the
community.
When you look at what is going on currently, you call in, you test positive, I mean, you're home.
Right.
So right now, it's not the best, but there's still room for improvement. The challenge right now is that the cases are too many, the population is more complacent.
Right.
But hopefully, we'll get back on our feet and do a better job.
We really hope that we do. Are there any local herbal remedies that have proven to be effective in managing COVID-19 related illness, in your opinion?
Yeah, well, in my opinion, first and foremost, Uganda as a country, we have over 60% of the population subscribing to traditional and contemporary medicine.
Really?
Those are the by traditional and contemporary, we mean the traditional healers, the pastors, the spiritual leaders, all that is contemporary. And then the traditional medicine where people do herbs. So we have a bigger population subscribing to that vis-a-vis the westernized medicine.
So you combine these two categories. There is the herbal medicine,
yes,
and then there is the, what you call that, religious, traditional,
spiritual
healing.
Exactly.
Interesting. That's a higher number than I would have expected. 60%?
60%.
Yeah.
So we are working, we are operating in a population that doesn't believe in our culture. You know, medicine is like a culture.
Absolutely.
So the biggest population doesn't believe in our culture. So they subscribe to another form of culture. Now, the story of local potions and traditional medicines, herbs, is not only unique to Uganda. We've heard of other countries like Madagascar, they came out strong with potions, Tanzania, name it. In Uganda currently, we've had breakthroughs of particular potions. I'm sure everyone is well aware of the various potions. But I would say there's still a lot we need to learn from these potions. And it would be good to see a randomized control trial from these potions, such that we are confident to use them.
Yes.
You know, it's not about if we use them now just because someone said they work, it feels like we've now run out of our culture, back to the traditional contemporary medicine. So I'm very happy that I think one of the potions is going to undergo a randomized control trial.
Okay.
And hopefully we shall learn a lot from that RCT.
Right.
What I would say is should people use them? I would be hesitant to commit myself, because you and me know that if not well studied, this could actually lead to grievous side effects.
Right. Well, personally, I've been exposed to a culture that is where Western medicine and traditional herbal medicine concurrently run hand in hand, and people subscribe to both. I majored in traditional Chinese medicine in China, Beijing, and it's, if not strong, I think it's a much more stronger system than the Western medicine there. But that's because there's systems in place, there's policies governing this, these trials. It's an alternative, but it is run just as serious and just as strong as Western medicine. Do you think that if we put such policies in place here in Uganda and, like you say, carried out more trials, that do you think people would then run away completely from Western medicine, and because it's already a very high number, 60%? Or do you think one day a time will come where both traditional herbal medicine and Western medicine works hand in hand together here in Uganda?
I think you're very right. We need good policies.
Yes.
To help the people trying to develop traditional or local medicines to bring their products to the world international standards.
Yes.
Will people run away? I think that shouldn't be our worry. Our worry should be, how do we incorporate the traditional, the cultural medicines into the modern day medicine? And that calls for dialogue between the stakeholders of both parties.
Right.
And hopefully we can win them over. Because
is it really a competition?
It's not a competition, but like I said, it's a culture.
Yes.
And we believe our culture is a better culture than theirs. And I believe if we sat on table, we dialogued, get there, it all comes from understanding of disease.
Right.
The spiritualists will tell you that disease is because of bad omen or a curse. Then we, the westernized doctors, will tell you that it's a microorganism that brings the disease. So if we all understood each other, this would put us at a better platform of saving the population, because the sole reason as to why we're doing this is to try and preside over a healthy population, productive population that will benefit the country and our followers.
Ultimately, we all want the same thing.
Yeah, definitely. The goal is the same, so we need to work together and achieve our goal.
Absolutely, I agree with you.
If we ignore the traditional healers, they will continue doing their thing, and the end result is not what we all want. What we all want is a healthy population.
I feel like we need to make an entire whole other video about traditional herbal medicine versus traditional healers, Jajja, Dagalaria Jajja, versus Western medicine. I think that would be a fun video. Would you like to be part of that dialogue?
I have a short certificate in culture and health.
Okay.
So I'm a bit passionate when it comes to culture and health.
Yes.
I've interacted with different kinds of healers.
Yes.
In Greater Masaka, in the Western Uganda. Yeah, their stories are interesting. We should do something.
Right.
Separate culture and health.
Yeah, so better stay tuned for that video. And by the way, for those that are just joining us, please comment below and ask Dr. Jjuuko, our resident Musawo, any questions that you have. I'm sure he'll be there to answer back. And also don't forget to subscribe to our channel, My Musawo, and press that notification bell so you don't miss out on future videos. Dr. Jjuuko, you're the former head of the COVID treatment unit in Masaka Referral Hospital. What is, or what was, the general vibe of the frontliners? I feel like not enough people talk about the frontliners or their experience during this pandemic. What are your thoughts on that?
Well, the experiences, every frontliner has their own personal experience. And every frontliner has a reason as to why they're in the fight. I'll tell you, when we started the fight of COVID, we just come out of a brief Ebola scare within the region.
Yes.
So me and my team, at that time I was heading the emergency unit of Masaka Regional Referral Hospital. So me and my team were ready,
Right.
somehow ready. But of course, this was COVID, it had challenged the Western world,
Yeah.
the people we looked up to, and there was generally a big scare. So this is the time before Uganda registers a case, around 18th of March. So it's a Wednesday and we get this suspect.
Yes.
Around 9:30, I still remember the details very well. So 9:30, we were in a senior managers meeting and someone posted on the hospital WhatsApp group, there's a COVID suspect in the outpatient department. Yeah, we all
Dun
froze.
dun dun.
Everyone froze.
Yes.
And fast forward, by 2 p.m., very few staff.
Really?
Very few.
Everyone ran away.
And yeah, so it was a dilemma.
Yes.
And everyone is like, who goes to attend to the suspect? And no one wanted to see this guy. So I'm like, you know what? Let me dress up. Let's see the guy. Because we needed to, because the following day was a day of work. It was a Thursday. And we needed to get the situation at hand. Yeah, and that's how the journey started. We dress up, go and see the guy. At that time the country was still confused. The ministry doesn't know what to tell us.
Yes.
We don't know what to do. We have no quarantine, we have no isolation center.
Right.
It was panic. So that's how it started. And the story of Frontline is really something memorable and something everyone should have a chance to tell
Yes.
the world. Personally, it was a bit. Sometimes it would be depressing.
Yes.
Occasionally, you would get the good moments, but then the stress that comes with being a frontliner. The most challenging things were when you lose your patient.
Yes.
The days you walk into the unit and you lost 5. And there's that relationship you get with the patients you're treating as a doctor, as a nurse, as a health worker. So when you lose them, it's like you've lost a part of you. And to be honest, it was really challenging. And now, the disease that is affecting these people would actually affect
you as well, yeah.
And it was really so scary. So every morning you'd wake up. As a frontliner, you have that fear in you, what if I contract the disease?
Right.
But then you have this push. You know what? The soldiers are not going to come and fight for us.
Right.
The mechanics are not going to come in. The media are not going to come and fight. So this is a medical workers fight. So that kept us going.
Right.
And slowly by slowly we learned the disease. We knew the tricks around it. We lost some. It was so depressing. I lost colleagues. The first doctor who sent me patients from within the region, leave alone the first patient we got,
Yes.
but the second and third and fourth patients in our region, the doctor who was able to identify them, investigate them, unfortunately lost his life. Rest in peace.
Rest in peace.
So it's really touching. I've lost over 20 colleagues, 20 people
Dear.
I was working with. But regardless, we move on and continue to pray for them to rest in peace. Very many of us got infected. I too got COVID. It wasn't a good experience.
Yeah.
Yeah, but surprisingly, from the time I got, as soon as I recovered,
You're back.
I was back on the front line. So it's weird. It's weird how you get the passion when you're on the front line. But to cut the long story short, the front line is both interesting and depressing.
Yes. How do you respond to, after having gone through all of that, and then you hear from the public, like, doctors are not doing their job, where are the doctors, these hospitals are poorly equipped, doctors don't know what they're doing. How do you respond to that?
It reaches a time, of course it's so demoralizing when people shut down the hard work you've invested. But again, I usually look at things like, oh, maybe they just don't know what they're talking about.
Forgive them, for they know not.
Exactly, because with the energy you've invested,
Yes.
sleepless nights, risking your own life. I mean, you don't have to do it. Yeah, but people continue shunning down the might of the health workers. They shun down the efforts. Of course, we leave that to God, and maybe at the end of it all, when we are done with the pandemic, they will look back and thank the health workers for the hard efforts they have invested.
Well, I can thank you now. You guys have done such a commendable job. I'm really proud of my country, Uganda, and our healthcare system. A lot of people seem to lose faith in it, but for someone that has interacted with other individuals from other health sectors around the world, we're doing pretty damn good. So
I'll tell you, we've really, the stories from the treatment units, when you see the heroic moments of the health workers,
yes,
it's amazing.
Yeah.
It's amazing. It's unbelievable, actually. The people would go out of their way to try and save a life.
Yes.
And to me, this is what we need as a country. We need that patriotism. I call it patriotism because
it truly is.
this is something that you probably don't have to do, but yeah, people would go all the way.
I think most people are just used to what they see on TV, the medical dramas, Grey's Anatomy. They see all this action happening in the United States, in Europe, and they can't imagine that Ugandans can have just as much passion and work ethic in real life, and they do. So thank you guys for all the good work that you guys are doing. Now, you mentioned earlier, Uganda was doing so well at the beginning of this pandemic, and then somewhere, somehow, our progress dwindled. And then the second wave happened, right? And we had such a sharp and devastating high death toll. Is there a specific pattern that you think the virus follows? And if there is, how can we better predict it to then manage it?
The virus, per se, doesn't move.
Right.
It's we the humans that move the virus.
Mm-hmm.
From human to human. It's human to human transmission. So we had a spike in June.
Yeah.
After a very long phase of, silence, and largely you blame this on the complacency.
Yeah.
Remember, people don't want to follow SOPs. To date, bars are open, sorry to say this, but people don't follow SOPs. And to me, that was the reason as to why we got the spike, and that is the same reason as why we're going to get another spike.
So you think it's close?
Definitely. I have a feeling we may not finish the year without another spike because the population is not following SOPs. So the virus rides on the fact that you don't follow SOPs. If you don't do what you're meant to do,
right,
then
it's bound to happen. It's bound to rise again.
Yeah, I'm going to penetrate the population, and then I'll come up.
Right. I'll never forget one of the things that the president said in one of his first public addresses last year. He said, yes, we are a developing country, but COVID doesn't know developing or developed country, right? And what's going to be our best bet to beat this thing is going to be discipline. And those words engraved in my mind because it really is all about discipline, isn't it?
Perfectly well said. Discipline. As simple as that. Once you're disciplined, we can move through this. It's not yet uhuru. People have this feeling. In Uganda, we tend to brush off things.
Yes.
Once something has been there for a while, that is it.
It becomes the norm.
It becomes the normal. But we are still in the window where we can actually be hit so bad by the pandemic. So people need to style up. Better still, to control the trend, the best would be one, follow SOPs.
Yes.
But there's a silver bullet, the vaccines, which we'll
absolutely. Yes.
At a later stage.
Yes, you just mentioned the silver bullet. Vaccines, vaccination. Our vaccines really the answer to ending this? And why are they the answer?
One, looking at the history of vaccines and disease, the only diseases the medical fraternity has been able to kick out are because of vaccination.
Yeah.
Look at polio, look at smallpox.
Absolutely.
Now, that alone is an answer to very many questions. And that is why vaccines remain the silver bullet. Vaccines are the way to go. Once you get vaccinated,
yes,
you know, the way to run out of a pandemic is herd immunity.
Right.
Herd immunity is basically developing an antibody bank
right.
in the population. Now, there are two ways of doing the herd immunity. Either you allow the very many to get infected, and then they heal, and then the remaining population has the antibodies. But of course, that comes with the cost of life.
Lives.
That model comes with the cost of life. So the other way to build herd immunity is massive vaccination. We are lucky that quite a number of vaccines are coming in. And hopefully the population can take it up. Because I think recently I saw a report that the number of people coming for vaccines is going down.
Really?
Yes, like I said, Ugandans, when it's flaring, they
relax, yeah. I don't think it's just Ugandans. I think that's just human nature.
Yeah, probably, but I think Ugandans do it at the top notch. Yes. So the vaccines are available now.
Yes.
At least I'm very sure. All districts have vaccines. We have quite a number of brands available, and I think they're safe. The vaccines are safe. So people will tell you about vaccines now. They want to kill us. They want to kill the Africans. I mean, there are easier ways to kill an African than investing billions in research to try and save the population.
Right.
And looking at the countries that have taken up vaccination strongly and have reached the WHO target of 40% of the population, the European countries, life is getting back to normal. Stadiums are full. It's a more appealing life than what we are living back home currently. So if people can take up the vaccines, I think we can win this.
I've met very highly educated people saying things like, my friend got vaccinated the first dose and then got COVID the next week. Therefore, the vaccine doesn't work. So that they haven't been sensitized that you need to be fully vaccinated, especially with AstraZeneca, especially with the vaccines that we currently have in Uganda. I've met people that still believe that this vaccine probably has a microchip that Bill Gates is, trying to control the world. Do you think that we could do a better job with the sensitization? I feel like we should.
Absolutely.
I think we can.
There's a lot of work we need to do as regards sensitization. And the focus should not only be on the population,
yes,
but also on the medics.
Absolutely.
Like you said, there are very many high-level medics that are still skeptical about the vaccine. So the only way out of that is massive, aggressive sensitization as regards to the vaccine, how it works,
yes,
its safety. And I believe, when you're managing a pandemic, once you lose one party, there are two parties. There are about three parties. There's the government,
yes,
the health teams, and the population. Now, once you lose one of those parties in the fight, you're bound to lose. So right now, it looks like the population is not yet so into the fight. So we need to win them back, and the only way to win them is through educating them, sensitizing them, and once they're on board, trust me, next year will be partying, life will be back to normal.
That's what I wish to see. We deserve a better quality of life. It's the thought that we can survive on a lockdown every time there's a surge is highly unsustainable. Kids need to go back to school. I have sisters that have friends and sisters that have kids in nursery school, and they don't know when or if their kids will ever resume school. And that is not sustainable. We can't go on like this.
Definitely.
And there's also the issue, I think, that most people are concerned about when it comes to vaccines, is that yes, they are available and the centers are known, but then you go to these centers, like I drove past Kololo Airstrip, I think once, when they were giving out the AstraZeneca there, and the massive numbers of people there was enough I think for another surge. I think that's around the time actually the second surge came up. So management of these vaccination centers, I think, is also another area of concern.
Yeah, sure. The good thing right now, there's been a lot of decentralization of the vaccination units and centers. So every district, and now it's upon the district to distribute to the regional centers, to the district hospitals, and to the health center force. So I believe with that, you reduce on the crowding, because crowding will, like you said, will send us to another wave. So there's that bit that needs to be attended to. And you mentioned earlier about people dying after being vaccinated, or people getting infected after being vaccinated.
Yeah, that's what people still think is happening.
Yeah, of course, looking at the most recent report by the Uganda Medical Association, they tried to study the doctors that passed on with COVID.
Yes.
And according to the report, most of them had not been vaccinated. Yes. So what does this tell us? You know, there's one thing about bad news. Bad news spreads
much faster.
Much faster than the good news.
Yes.
So we need to go out to the population. We need to be on ground, use the media houses, educate people about the vaccine. If you look into most of the cases that have passed on with a claim that it's the vaccine that...
Right.
You find that it's actually not true.
Yes.
It's not true. And the only way out of this is massive sensitization, trying to win the population back.
Yes. And even with the concern people had, especially with AstraZeneca, that majority of young women were dying after taking the AstraZeneca vaccine. There are cases in Europe where that was true. But then again, you compare 1 in a million people. I think all vaccines in vaccine history have had cases like that. But then we didn't stop taking polio vaccines because of that. So I think the sensitization needs to go on, it needs to go harder, and people need to weigh their options. Am I going to stay worried and hiding and in fear because I don't want to take a vaccine, and am I going to risk myself probably losing my life or my loved ones losing their life just because I'm feeding into these misconceptions? And I think, like you say, the only way to mitigate this is with massive sensitization.
Yeah, sure. And the population needs to know that the chances of you dying when you get COVID, vis-a-vis the chances of you dying having been vaccinated, the numbers are totally in opposite directions. So you stand a better chance to die, if I would say that. You're at a higher risk of dying when you contract COVID than when you get vaccinated. So,
or rather, when you contract COVID without the vaccine, than when you contract COVID with the vaccine.
Exactly, you stand at way better chances.
Yeah.
I've seen very vulnerable people coming into contact with COVID, and because they were vaccinated, I mean, they even never feel a symptom. Yeah.
Yes.
So it's the way to go, and people should really come up and take up the vaccine, and hopefully we'll get back our life. I know all Ugandans need that life, and the only way to get that life.
So you heard it, guys. Comment below and let us know if you've got vaccinated. Let us know, are you vaccinated or not? Have you gotten your first dose? Have you gotten your second dose? Are you waiting for another type of vaccine? Let us know in the comments below. Dr. Mark, will this ever end? Will our kids ever go back to school? Will the economy ever recover? Will COVID-19 ever be a thing of the past?
Definitely it will come to an end. It's sad that, right now I'm a student. At a certain point, I kept asking myself the same question.
Yeah.
When am I going back to school? And it's because of COVID.
Yeah.
Because we had to shut down. About 80% of my class had COVID.
Oh no.
So, will it end? Yes. The most important question is, how are we going to make it end?
Right.
And like we had earlier discussed, the only way we're going to make this end is through getting vaccinated. And if everyone can come on board, we can end this.
Yes.
But if people remain complacent, then we shall follow the naturals of the pandemics and epidemics. It can take about 3 to 4 years to clear. But if people the only way we can modify that is by getting vaccinated, and this is going to end. So
right.
if we get vaccinated, if we can have like 40% of the population vaccinated, probably by mid next year, then it will be a story of the past.
That's if we can get enough vaccines into the country.
Yeah, I think
because that's a whole other thing.
It's a whole other thing. But I think the ministry is trying its best.
Yeah, I'm sure they are.
Yes,
Yeah.
I'm sure they are really pushing and trying to get the vaccines in and making sure that people are safe. So if we can get to the culture of being vaccinated, I mean, people, the funny thing about people is we've all gotten vaccines. The polio vaccines, unknowingly.
Right.
Mothers day to day flood vaccination centers in the hospital to vaccinate their children, but they never ask.
Right.
But you wonder why they are so skeptical about.
I think it's because and my brother has told me this. It's because they know that the previous vaccines that we know of have taken years and years and years in trial, while this just only took a year and a half.
I guess that's in the advancement of medicine.
Absolutely, it's 2021.
I mean, yeah, it's 2021. You can do anything on your smartphone. So why can't they push out a vaccine in a short time?
Or the smartphone.
Yeah, so people shouldn't be skeptical. Let's take it up. Let's get vaccinated and can end this.
Dr. Mark, what would be your final message of hope to the Ugandans?
My final message to fellow Ugandans, countrymen and women: it's not the end of the world. We can win this fight. And the rules of this game are simple. Follow the standard operating procedures. Wash your hands, put on a mask, social distance, get vaccinated. I repeat, get vaccinated. It's our silver bullet. Once we don't do this, we're going to be in this circus. Lockdown, open up, lockdown, open up. But if we can bear the short time of suffering, of following strictly following the SOPs, getting vaccinated, let's use this time to get vaccinated, then we can go out and enjoy when times are safe. But if we continue, sneaking into bars, continue crowding, then we're going to go into several waves. And the story will be repetitive. Wave lockdown. So my message to Ugandans is, let's follow SOPs. Everyone knows what to do. Everyone in this country knows what to do. Let's just do the right thing. And in the meantime, get vaccinated. And hopefully, we'll see you soon in the stadiums, in the bars, and everyone back to their normal life.
Thank you so much, Dr. Mark, for being here. It was a really good chat. I think it was a conversation well long overdue, right?
Sure.
Yeah. And thank you out there at home for watching. Don't forget, this is going to be part of the COVID-19 series right here on our My Musawo YouTube channel. So make sure you check back for future videos and those that we've shot in the past. If you haven't subscribed to our channel, what are you waiting for? Subscribe now, hit that notification bell so that you don't miss out on any videos. And please comment below, ask our good Dr. Mark here any questions that you might have. I'm sure he'll be more than happy to answer back. And until next time, stay safe, stay healthy, stay happy. Thank you.